So Tim, antibiotics, antimicrobial resistance, I mean, it's a wave. I mean, last week we had Antibiotic Awareness Week. Everywhere in newspapers, we have presidents talking about it. But from your perspective, in your daily work, what does antibiotic and antibiotic resistance actually mean to you?
Well, antibiotic resistance is one of the biggest threats that modern human healthcare and modern veterinary healthcare is facing. And it's artificial to draw a distinction there, and the One Health concept is recognising that we're all in this together, because certainly in the UK, nearly half of all households have a pet animal, so that's millions of people having a daily close contact with millions of pets. A lot of the organisms, the bacteria, are very similar. We share them between us. We use many of the same antibiotic drugs. The antibiotic resistance genes are all the same. So the widespread emergence of resistance, if this continues, it's going to have a massive impact on what we've regarded as modern healthcare. And this will be twofold. One is it's going to increase the costs and the difficulty and the mortality rates associated with treatment, because there are very few drugs that we can use for some of these very resistant infections. And secondly, it will actually change the face of modern medicine. So a lot of things that we've become used to as routines, so major surgery, joint replacements, chemotherapy, and so on, will become impossible because the risks of infection will just become too great. And so this is a problem that we urgently need to get better about. We need to look at the way we treat bacterial infections more wisely, so that we can preserve the efficacy of these drugs for the future.
I mean, clearly you feel sufficiently concerned to become part of this GRAM initiative, and when we surveyed companion animal veterinarians around Europe, despite the enormous amount of advice that is there, the cascades, the WHO recommendations, that it was still felt that an expert panel such as your own had a role to play in providing practical and pragmatic guidelines. If you look at GRAM and you project 5 years forward and look back, what do you think, what do you hope GRAM will and can achieve?
I think GRAM is a hugely important project because it's something that is bringing together a very wide range of clinical, microbiological and pharmacological expertise across a very wide range of infections and organisms, and infection control and other fields, and bringing it together into one easily accessible resource. Now we're getting better in veterinary medicine. I think we've been behind human healthcare on advice on appropriate antibiotic therapy, how to test appropriately, alternative treatments, infection control and things like this. And we're improving, but the guidance is still patchy. So there are some diseases where we have published guidelines, there are other diseases where we don't. But a lot of these are in very disparate areas, and it's sometimes difficult for busy first opinion practitioners to be able to find these. And I think GRAM is a way of distilling the current body of knowledge into something that is then easily accessible for practitioners. And it has broken things down into very small chunks. So if a practitioner has a specific problem, for example, respiratory disease in a dog.
We're going to have to cut it. That is my... I switched my phone on, and that's such an amateur mistake. Really,
it's always bad when they're direct.
Sorry.
So if I go from, for example.
Yeah.
So for example, if a practitioner wants to answer a specific question on how do I treat an upper respiratory tract infection in a dog, there is a very small chapter. They can read through this and assimilate the information very quickly. If they're broadly more interested in the background for some of the choices, there are areas where they can read things perhaps at their leisure. If they want to start looking at how to reduce the risk of infections post-surgery, we've got sections on that, infection control, and so on. So I think it's a very valuable resource. I think it will be hopefully widely picked up throughout Europe. It's designed to cover the different types of practice, drugs available and so on within Europe, and to very much improve veterinary practice in regards to treatment and management of infections across the whole continent. This is really important because if we do nothing, we will be facing a future where our access to effective drugs it might become more restricted as these drugs become restricted for human use, but also treatments just become harder because a lot of the drugs we use will become ineffective in the face of these resistant organisms. And a chilling example is I've spoken to colleagues who work in referral dermatology in the US, and up to a third of the cases of skin infection they see are now resistant to most of the antibiotics we would normally use, and this has made a huge difference in their practice and how they have to address things.
I mean, the final question is really, you talked about the future, and it's a very broad question. What is the future of antibiotherapy? But, you know, is there a sense that we can actually manage what the future will be as well?
Well, we face two futures. One is the apocalyptic future that the British Chief Medical Officer, Dame Sally Davis, and our own Prime Minister David Cameron, the US President, have all talked about, and that is a post-antibiotic era when we go back to the medicine that was practiced in the 1920s and 1930s. And that will happen if we do nothing. If we get better about how we use antibiotics, we can slow the development and spread of these resistant organisms down. It will buy us some time for the future. It will enable us to continue preserve the efficacy of these drugs and enable us to continue to develop high quality medicine. And there are three planks to this, and one is new drugs. But new drugs are not the only answer because they may be very restricted in their use for very resistant organisms. They may not be appropriate for all infections, but most importantly, if we don't get better about how we use antibiotics, all we've done is reset the clock slightly because we'll just develop resistance to those as well. So the other two arms to this, which are equally important, is one, better infection control. So we stop these infections taking hold in the first place within veterinary healthcare environments. And then the second is getting smarter about how we use the existing drugs. And this is understanding the importance of these drugs and essentially using them more wisely and using them less often by getting better at diagnosis, so we make sure that there is an infection before we treat it, that we use the drugs more effectively by understanding which drugs are best for which infections, understanding which drugs will work best in which organs and things like that, and that's where the GRAM guidelines have a huge role to play in general veterinary education. And then finally, by looking at non-antibiotic means of controlling infection and recognizing that by managing the underlying disease, by using topical antiseptics, for example, we can actually manage a lot of these infections without the recourse to systemic antibiotic drugs. And again, a lot of this information is sometimes very difficult for first opinion practitioners to have at hand or to easily get hold of. And one of the great values of the GRAM initiative is it brings this together into an easily accessible format for practitioners to use in their daily practice.
Yeah, sorry, I said it was the last question, and I know you've got to get back. In terms of, there's a sense that I feel in many ways not so much in the companion animal area, but if you look at more intensive animal production, that the veterinarian has been bypassed to an extent as part of a prescription process that was there for very good reasons. And we see a lot of misunderstanding both of livestock owners, pet owners, just the general public about antibiotics and antibiotic resistance. What role do you think the veterinarian and the profession can play in educating and bringing the professional, the veterinarian, really back to the centre of this whole prescription process?
Well, I think there are two sides to the antibiotic prescribing coin, and the first is the veterinarian, the veterinary clinician, and we've already talked about how the GRAM initiative and other guidelines and so on are working towards making sure that veterinary prescribing is as good as it should be. But the other side to that coin is the animal owning public, so livestock owners, pet owners, and so on. And as clinicians, we can be as good as we can in terms of our antibiotic use practices, but that will count. The impact of that will be reduced and will count for less if the owners aren't. So we do need a big public education program to educate the animal owner in much the same way that health authorities throughout the world are educating the general public. For example, not to expect antibiotics all the time, to understand that actually a lot of diseases don't involve bacteria, that even many bacterial infections will actually just get better by themselves given time and maybe some topical antiseptics, for example. And so to reduce that level of expectation, but then for people to understand that if they are given antibiotics, they should always follow the veterinary prescription. They shouldn't get them without a veterinary prescription, and then they should stick to the exact dose, the dosing interval, and the course of treatment, and not change anything without speaking to the veterinarian first. And I think it's a partnership. It's a veterinary public partnership, if you will, and I think there's education on both sides there that will help